Hi, I am Dr. Ahmed Ergin, for those who do not know me, and we are a telemedicine company treating diabetes remotely. So you have an endocrinologist and diabetes coach anytime, remotely monitoring you and treating you. Now, let's go to today's topic. So today we are talking about normal blood sugars. In a healthy individual who does not have diabetes, the normal blood sugars is defined between 70 and 140. Now, normal blood sugar depends on the situation. Are you fasting after a meal? How long you're fasting? How long after meal? Why I say that is because your blood sugars is very fluid. It's very dynamic. Most people think that the diabetes or the blood sugars, are just a straight line, or they expect it to be a straight line. It's not just going to happen. It is constantly changing. If you are hungry, you didn't eat food for 5-6 hours, your liver is trying to compensate from the depot to bring you some sugar to the blood, but your blood sugar may go as low as 70, and if you exceed that fasting period, if it goes 16 hours, 18 hours, 20 hours, depending on how much stores you had beforehand, you may actually even develop low blood sugars. So low blood sugars do not necessarily develop only after a couple hours of fasting, but it generally happens after a prolonged amount of fasting. As I said, at least 16-18 hours, because your liver can only compensate for glucose production for up to 8 to 10 hours. After that, you start burning fat. That is called ketosis. That's why a lot of people on keto diet are in that situation, and they are burning fat. But eventually, that may not be enough, and low blood sugar may develop. Most of the time, this is a rare situation, but for patients with diabetes, high blood sugars happen frequently. That is because their body is not able to make enough insulin to keep the blood sugar within range. So, most of the time, if somebody's blood sugar is going about 140 after eating within the first 2 hours, we call that impaired glucose tolerance. So your body is having some trouble already. That's why we do 2-hour glucose tolerance test to see how your body is handling the sugar load that we are administering to you. So if you're exceeding 140 after within 2 hours or after 2 hours, then there may be a problem. If it is between 140 to 200 within 2 hours of eating, that is impaired glucose tolerance. If you exceed 200 blood sugar at any point during the day, after meals most of the time, of course, we may qualify you as diabetic. Now, I don't like to use the diabetic word, but I will say we would diagnose you with diabetes. Now, diabetes is diagnosed generally with at least 2 values, with sometimes fasting blood sugars more than 126, with a anytime blood sugar more than 200. But if you have symptoms of diabetes, for example, let's say you're excessively thirsty, you are urinating a lot, you have fatigue, you're losing weight, and your blood sugars are more than 200, you don't really need to do more tests. Then we call that diabetes as well if you're symptomatic with blood sugars more than 200. Most of the time, we diagnose diabetes now a lot earlier because we do a lot of screenings. Still, some people who do not want to see doctor end up seeing the doctor because their blood sugars are in the 300, 400s, 500s, and they have symptoms. That is still seen, but it's less common than before. Now, again, when you eat, your blood sugars can go up. If you have a diabetes, we still consider that under control if you are not exceeding 180 blood sugar at 2 hours after eating. But if you are going above 180 after meals, then that is uncontrolled and your A1C will be more than 7%. Most cases, unless you're having a lot of low blood sugars, because A1C is just a definition of average blood sugars. So again, we do not want you to have very high blood sugars or very low blood sugars. It is going to be within a range. If you have diabetes, we expect you to live between 70 and 180. 180 being the upper limit, 70 being the lower limit. If you do not have diabetes, your upper limit will be 140, your lower limit is again 70. 70 is the medical definition to consider somebody to have hypoglycemia, which is low blood sugar. Please refer to our previous videos about symptoms of low blood sugars, how to treat low blood sugars, and how to avoid low blood sugars. And if you have not subscribed to our channel yet, please do so you can get a few videos, educational videos every week. And that is very important because I believe the knowledge is the power, and the more knowledgeable you are, the better patient you are going to be with diabetes, and you are not going to let diabetes take over you, step over you. So these are the definitions. If you are having problems keeping your blood sugar in this range between 70 and 180 with diabetes, or you do not have diabetes but your blood sugars are actually going about 140 after eating, and if you have diabetes, if it is going more than 180 after eating, then you may have a problem. Then please call us. Again, you do not have to physically come see us. You can if you need to, but most of the time that's not necessary. We just send you some forms to sign electronically, very secure, HIPAA compliant, and then all you have to do is see me on the video just like this, and then we continue to track you through our monitors. Everything that goes to your app, if you can use an app, that's great. Everything that goes through your app comes to us. If you cannot use an app, you're not very tech savvy, that's okay as well. All you have to do is take a picture of your paper logs and send it over to us. As long as you can text, we should be able to handle you and help you. But if you can use our app, that is a lot better, because then we can stay on top of your blood sugars all the time. Again, we are able to receive text messages and emails from you. So this patient satisfaction is very important to us. So call us at Sugar MDs, and we will help you the best we can.